Hi, I'm Prinzbach. I'm going to be a sophomore at the University of Richmond next year, and I am part of the science internship program here. My research is preoperative demographics and injury characteristics of pediatric and adolescent patients with meniscus pathology. All right, so sports constitute one of the fundamental aspects of the American lifestyle and childhood. Between 30 and 40 million children and adolescents participate in organized sports each year. This involvement has been rapidly increasing over the past few decades, and this has also led to an increase in the number of sports-related injuries each year. An average of 3.5 million injuries occurring in adolescent sports have happened each year, and one study has shown that 65% of 4.3 million sports-related injuries in just 1 year were incurred by individuals of 19 years of age or younger. That's more than the majority. There's several speculations for the increased injury rates, such as participation in sports at earlier ages, and also the increased intensity, length, and frequency of practices. The most common areas of sports injuries are typically the lower extremities, and like the ankles and the knees. And so in my research, I looked at the increase in the incidence of meniscus injuries in both adolescents and children. The meniscus is a wedged and C-shaped portion of cartilage that is located in the knee. It serves to protect the joint and maintain stability, so it is very important. It is important in load distribution throughout the knee and also will bear and distribute the weight of an individual. So this means it is vital to the long-term function of the knee and for prevention of future pain and injuries. This is just two diagrams of an axial view and a lateral view of a knee, and you can see both the lateral and medial meniscus as well as important ligaments like the ACL and PCL, which are also common injuries in sports injuries to the knee. This is a diagram of various meniscus tears, and as you can see, a small tear such as a radial tear can progress to a complex or degenerative tear. These tears, if are not fixed, they can become very detrimental to the function of the knee in the future because these tears may cause the knee to lock when you walk or to give way, which will impair mobility. And also, in addition, they may lead to the erosion of cartilage surfaces in your knee, such as those of the femur and tibia, which can lead to future arthritis. This is another diagram of meniscal tears, and also on the bottom left you can see an arthroscopic image of a medial meniscus that is torn. This is how it would look during surgery. So in our research, we wanted to come up with several demographic factors that we thought would affect the injury rates of knees in children. And this could be their age, BMI, sex, or pubertal development. There are also several differences in knee injury rates between males and females, and numerous studies have supported these differences. There can be anatomical differences, hormonal differences, and differences in motor control of knee function, which often leads females to get injured more frequently than males. Obesity is also a growing problem of concern in the United States, and according to the CDC, approximately 12.5 million children and adolescents are considered obese, and this rate is nearly 3 times what it was in 1980, just 3 decades ago. So BMI is body mass index number, and increasing obesity obviously leads to a greater BMI. And we looked at the BMI to see if higher BMIs would correlate to greater frequency of injuries in the knees. Your body mass index number is different than your BMI percentile, however, which can be found on a chart like the one you see here. And the healthy range is considered the 5th percentile to the 85th percentile. And there are different BMI charts for adolescent boys, adolescent girls, and also adults. And these percentiles can be determined by looking at your height and weight on this chart. So the purpose of my study was to examine patient records from 2 physicians in order to determine if obesity, as determined by BMI percentile, as well as age and sex, are common findings amongst young patients with intra-articular knee pathology. So we had several hypotheses in this study, and we said that children with a BMI percentile that is considered overweight will have a higher frequency of these knee injuries, and also, based on current literature, that adolescent females will have a higher frequency of ACL tears in addition to their meniscal injuries, and also adolescents who are older in age are more likely to sustain ACL injuries combined with meniscal injuries. So we obtained IRB approval for this study, and this study was primarily done by looking through electronic medical records from two different orthopedic surgeons here at the Cleveland Clinic. They're pediatric orthopedic surgeons, Dr. Paul Salwan and Dr. Richard Parker. So our patient population consisted of subjects below the age of 18 at the time of the injury, and also there had to be arthroscopic evidence of their meniscal pathology. This means that when the surgeon went in and operated on the knee, that he confirmed that their meniscus was torn, and that patients who only had MRI evidence of this meniscus tear, they were not counted in our study. So we overall collected 223 patient records, which dated from April 2002 to May 2010, and there were 216 different subjects because 7 had bilateral injuries. And some patients had multiple injuries to the same knee, but if they did, we just used information from the first injury and just noted it later on to see if their future injury affected their return to sports later. So these electronic medical records were examined, and we recorded their gender, date of birth, height, and weight, all in an Excel database. And in addition, we looked at the mechanism of the injury, so what sport they were playing when they were injured, like what movement they were doing when they got injured, what day they got injured, what year. And then we looked at the differences between what the physician diagnosed the injury as, what injury the MRI was found, versus what injury the surgeon noted during the operation. So sometimes these injuries that were found were different. And we also noted what surgical procedures were done during the operation. So a few patients were seen by doctors at other facilities, but we just used the operative notes to get the information for those patients. This just is a chart equation that shows how you can calculate BMI. So you multiply your weight in pounds by 703 and divide it by your height in inches squared, and that way you can get your BMI number. And then you can find your BMI percentile by looking at the chart, but for this study, I went on a website that by entering the patient's gender, age, height, and weight into this BMI calculator, it told me the BMI and the BMI percentile, which was very convenient. And also, finally, we did statistics and graphs to analyze this data, so we used unpaired t-tests and multiple logistic regression models in order to compare the different factors. This chart shows just some of the averages for our entire cohort. So our average age was 15.29 years, while BMI was 24.66, and the average BMI percentile for the age was the 74th percentile, which, although in the healthy range, is slightly towards the upper level of it. And this complicated chart shows significant relationships between the patient's demographics and the meniscal pathology in addition to ACL injuries. So the number 3 you see there next to female gender would indicate that females were 3 times more likely to have an ACL injury in addition to their meniscal injury as compared to males. And the age would mean that adolescents who were older were 1.48 times more likely to have an ACL injury that was simultaneous with meniscal pathology. So for BMI percentile of greater than 90th, which means that children who were overweight or obese were 2.11 times more likely to have an ACL injury with meniscal pathology. And if both menisci were injured, then the patients had, as you can see, a very high chance of getting an ACL injury in addition to their meniscus injuries. This graph shows the different sports that were being played at the time of the injury. So you can see they're kind of gender biased because football and wrestling are all males and have no females. But for males, the most frequently played sport at their injury was football, and for females, it was soccer. But overall, for the most injuries per sport, it was basketball for the knee. And this just shows that there are more right knees injured in our study than left knees. And this could be because of sports, and maybe the right leg is more dominant for many players, so it was injured more. This shows the average BMI percentile by age. So as you can see, for age 14, males had an average BMI percentile of the 84th percentile, while females had the 76th percentile. And as you can see, towards the lower numbers, it is kind of skewed because we did not have many young patients in our study. And in addition, in general, the males had a higher BMI than females, but this could be just because that the males had more muscle mass, not necessarily because they were obese. This graph shows that the injuries that were diagnosed by MRIs, and as you can see, an isolated lateral meniscal tear was the most common injury that was diagnosed by MRIs. The second most common injury was ACL and medial meniscal tear combined, but this is different, as you can see on this chart, which is the injuries diagnosed from arthroscopies. The most common injury, again, was the lateral meniscal tear, but the second most common is the medial meniscal tear instead. And these differences are just because they're different. The MRI showed something different than what the surgeon confirmed during the surgery. So for conclusions, we decided that, or concluded that females were 3 times more likely to incur an ACL injury compounded with a meniscal injury than males, while older adolescents were 1.48 times more likely to have had a simultaneous ACL injury along with the medial meniscal pathology. And then finally, that patients with a BMI percentile of greater than 90% were 2.11 times more likely to have sustained a simultaneous ACL injury in addition to their medial meniscal pathology. And all these conclusions were derived from the statistic data, and all of the p-values, as you can see there, were very small p-values indicating that this data was significant, because we did have a lot of other data, but it was not significant. We also concluded that the average BMI percentile for the cohort was the 74%, which, while still in the range of considered healthy, which is the 85th percentile, it is higher than average for the respective age groups. And the most common injury diagnosed from the arthroscopies and MRIs was the isolated lateral meniscal tear. So for the future, this study would best be done as a prospective study, which means that we could find a group of kids from a certain city and start following them at middle school and track their age, their BMI, their gender, their height and weight, and then follow them throughout their middle school and high school careers in sports and document any changes in their height and weight, and also if they had any injuries, and then look back and see which factors were primarily influencing these injuries. In addition, a future research can include contacting the patients of this study with surveys in which they indicate their ability to return to sports and their needs in their post-operation. All right, so thank you for listening to my presentation, and I'd also like to say special thanks to my mentor, Paul Salwan, and his resident, Dave Schub, who helped me a lot with this research. I also would like to thank the Orthopedic Surgery Department at the Cleveland Clinic Sports Health Center, also Manny at Marymount Hospital for everything he did, and then the Office of Civic Education's Annette Starling for all she did for the program. Thank you.